Hey, everybody. What's going on?
Hi,
Happy New Year.
I'm here. I'm just eating.
Me too. Happy New Year. Terry, did you send us the agenda and all that stuff?
I forgot. We mailed them out. And
No problem.
I did not send them.
Don't mind me. No, it's been nonstop all day as it is for everybody, I'm sure.
Yeah, give me one
I'm
second.
still
I'm sorry I have to be off camera for a little bit. Eventually get back on. I'm so sorry. I
no,
got
no,
something
no, don't
going on.
worry. I'm gonna go off too because I'm trying to get a little hot soup into me.
Me too.
Okay,
I'm
thanks.
stuffing my face. I'm trying to
Do
eat
we
all.
need to talk about anything? We should be good, right?
The only thing I can think of is if you want to run through the discussion about nominations.
Yeah, I guess we can. You know what? I didn't bring home my notes. I really apologize, but yeah, we
Um,
could go through that.
So here's what I worked out. These are the only people that are eligible for chair because they're the only ones who have been a past chair. And it's my understanding that I am presenting this.
Okay.
People can accept the nomination or not. And then, so I don't know how you want to do that part. Like, do you want to poll whoever's on the ballot? Or do you want to not say anything and wait for people to get nominated and then ask them if they accept it? Like, this is why I hate this process because it's always so messy to me.
Terry, I think to make things easier, we should present this nomination ballot to people.
Okay.
I don't know why we should make it more complicated. You know, and then people could I think they could either accept or not accept, right? Their nomination.
Yes, I just want to make sure that we add, like, that's part of today's discussion. But yeah, I mean, that's fine.
Yeah. So. And
I'm going to.
yeah, I'm lost without paper, so.
Yep, I'm sending it now. I'm gonna.
Yeah, no
I'm just gonna go
problem.
ahead and send it from mine email. Wait, I'm gonna send it through. I gotta give me 1 second. I don't want to log out because I need to log back in. I need to
So
log.
I don't know if there might be I did have that one patient and I know Catherine invited somebody else, so I don't know if they're coming.
I know somebody that I am not familiar with RSVP'd for recognition.
Oh, who?
So Giovanni?
Giovanni.
Yeah, I don't know who it is. I have no idea.
I don't know what Giovanni.
I texted Jen and asked her who they are, but I haven't heard back from her yet. So
No problem.
okay. Dang it, it's wrong. Did I log into the wrong one? Yes. Okay, wait, I'm already logged in. Okay, perfect. Who is asking for the Zoom link for tonight's meeting?
Hi.
Hi. How are you?
Hello. I'm okay. Getting myself
Hi,
set.
Kathleen.
Am I still sharing?
Hi.
Okay, good.
We're getting ourselves organized, the executive committee.
Oh, look at your sassy new haircut.
I know, she's retired.
Congratulations. All right. I gotta text Dennis. Okay. That's the only thing I can think of that you might want to discuss in advance, is, well, I mean, we already did, so I feel like I think we're good. How does it feel, Kathleen? I was in a meeting yesterday with a bunch of people, and it was really funny because everyone said, I'm retired. I just retired. Me too, me too.
Um, it doesn't feel real yet. It just feels like a vacation right now. So I don't have a routine yet, and so we'll see as it goes.
Carlton and Cheryl aren't going to be at the meeting tonight because he has surgery tomorrow. He just told me. He just called me up.
Okay, he might need to take a leave of absence, but I'll talk to him about that.
Okay, I'm just getting my camera together here. Can you turn to?
How's everybody in the weather?
Well,
Okay.
I flooded last time, and I am expecting to flood again this time. The good news is I haven't cleaned anything up yet, so at least it's only one cleanup, but it's
Hmm,
I don't know if she did this.
Did I not change my background?
I am sending the agenda. Oh, no, okay. January is the agenda. Dang it, I have it opened. Oh, maybe that's what I need to do. Okay. Okay, here we go. File, download. I'm just gonna send everyone a copy of the nomination ballot in the email as well. Mail. Sorry, it's taking so long. I'm going back and forth between my email and Jen's.
Can you turn it down a little bit?
Okay.
Your 36-minute timer on Kitchen Echo Show is ringing.
Alexa, stop. Okay, I'm sending minutes, agenda, and ballots And then on the meeting link, that way people can join us. And then I'm gonna send a separate email. Well, yeah, for the other stuff. Good evening, everyone.
Kitchen Echo Show.
Trying to cook everything in case we lose power. Well, not everything, because I can't, but I like cooking all the expensive food, so at least we get to eat it.
I drove on the turnpike today. It was horrible. And Route 1 was even worse, surprisingly.
Yeah, I'm glad I didn't have to leave today.
Hi, everybody. How you doing?
Hello,
Hey,
Steve.
Steve.
How's everybody doing? Okay.
So far.
Okay, for you.
I'm hanging in there. Just can't believe it's into January already.
Yeah, almost halfway through already.
Yeah. Hi, Roseanne. You know, it was funny. I stopped at a convenience store, Quick Check. It's 2 days after Christmas, and they had chocolate bunny rabbits wrapped in gold on the counter for sale for Easter already.
Oh,
2
yeah,
days
you,
after
right,
Christmas.
right away. I went to like TJ Maxx or one of that same thing, Easter, Valentine's Day stuff was
Valentine's
out
Day.
before Christmas
I
was
know.
started. I mean, before the 25th, let's say, whatever.
Yeah,
Valentine's Day, come on.
yeah. I was
Yeah.
just saying, Dennis, Roseanne and I both saw Easter candies right after Christmas.
Oh,
Come
yeah,
on.
the Home Goods is all full of Easter. I mean, there was bunnies popping
Ah.
out everywhere.
Yeah,
No, there's no rhyme or reason.
yeah,
That's retail world. Just keep it going.
yeah.
Anyway. Terry, I'm trying to mute. I'm trying to change my background to blurry.
Okay.
It's not letting me do it. I just keep getting a big hand. I
You
don't know.
Are you going to stop video, like the video carrot, and then you should just be able to hit blur my background?
Okay, when I click on again, I have a big hand. There's like a big white hand. That's all. I normally, let's see now.
Are you
Blur
using
my
kind of
background.
tool?
Got it now.
All right, cool.
There you go.
Thank you.
Yay! I just figured that out myself.
I didn't clear off my countertops. It's like upside down here, so I'm embarrassed.
Yeah.
Be embarrassed.
I know.
Just blur your background like I do.
Yeah, that's why I was like, can I have that blurred? Plus the glare of the high beam light on. I got my lantern next to me
Yeah.
just in case.
Oh yeah, me too. I got my
The
little
lights
crank
go
radio
out.
thing.
Yep, it's my lantern. And then making sure my cell phone is charged.
That's a good idea. I never thought of
Ooh,
that.
I should do that myself.
Yeah, I mean, we
Come
have
on,
the light out
guys.
there and
You had all day.
What's that?
State of emergency, Governor Murphy, state of emergency. It's been on
Yeah.
TV all day.
I have my
Oh,
my flashlight right next to my
And my little radio that you crank, that's
Yeah.
a really handy one.
I got my
I'm
Mine
hoping,
doesn't work.
I mean, is it bad out? Is that,
No, it's just
No.
raining. I mean,
yeah, it's not
I-
like monsoon
Nasty.
rain.
It's just
I don't know.
nasty.
They make such a big deal out of every little storm lately. Like last
Mm.
week, they were putting that pickle juice on the road from Wednesday for snow we were supposed to have on Saturday, that it snowed for 5 seconds. And then it rained. It's
Yeah.
like, okay. I think they're making a big deal out of it.
Yeah. Yeah.
Better safe than sorry.
Did I not send that to anyone? Did you, oh, you guys probably did. Did you guys get the link?
I just looked, I didn't see it. Let me try again.
I think I sent it to myself, like, I don't know, I don't even know how I did that. Never mind. I'm just gonna redo the.
Yeah, I don't see it.
Ugh. Well, on the plus hand, now I can send you one email instead of 4, so good news for that. Okay. Oh, yeah, that's exactly what I did. I didn't use the planning council list. I just emailed myself.
I hate when that
Okay,
happens.
no worries. Take your time, take your time. It's a new year, lots going on.
Oh yeah.
We're good.
Okay.
Prostate cancer surgery. And there's more breaking news.
All right. Hopefully you all just got that.
You're right back.
And in the meantime, I am going to share the agenda. Those are her account.
I don't know who has a background noise on. I hear like a radio or something. Do people hear that too, or am I just hearing things?
I hear it.
I hear it too.
Yeah, so let's make sure we're all muted. And we'll give, obviously, we're giving people a few more minutes. So. No, I don't hear it. Thank you.
I'm not sharing, right?
I got it.
Awesome.
Did you send the link to Jay? He just called me.
Yeah, why doesn't anyone have their calendar links? Like, why isn't that happening? I did just send it to Jay.
I had it. I don't think he knew, so I told him that I'd send him the link right now, so
Yeah.
he'll check it and he'll get it.
Bless you.
Thank you.
Yeah, that's it. Actually, I did find the link. It was in my calendar. Forgot it disappeared.
Yeah, I try to use that, let me check the other email.
I got all the stuff.
Tanya here yet? I'm expecting Tanya.
Yvonne, I like your background, how you're able to put Zufall Health in the back of your screen there. It looks pretty good.
Oh, thanks. They created this for us. I guess it's like the new company thing, company branding.
Yeah, we have one too. We have one too, Steve. I just never uploaded it.
Okay. Is it bright orange?
I don't know. I never looked at it.
All right, I'm expecting Jay and Tanya. There they are. Yeah, both, like John said, we're not expecting Carlton or Cheryl. She's got a childcare situation.
Happy New Year.
Happy New
New
Year.
Here, Jay.
Happy.
Happy New Year.
I'm gonna be on, but I'm not, I mean, let me say how I'm gonna say this. I'm gonna be on and for the votes and stuff, but I probably will have my camera off.
Thanks for letting us know.
Okay. Everybody had a good holiday?
I was sick.
Yep, me too. I still see it.
Yeah, me too.
Oh, wow.
Twas
That's all
the
right.
season. Yeah.
I got a lot of rest anyway.
Well, that's good. We got a full house. It's good to see everyone's face.
Yep.
Good to be seen.
Laura, hi, Laura. Okay. I'm gonna be blind, but I'm here.
Okay.
All right, so I guess we could begin the meeting. And Terry was just sharing the agenda.
Yeah, you want me to just put it back up?
Well, I need to read the stuff from it.
Sure.
I could, okay.
That's at 150, is that?
Yeah, I could read it. I just need the other side. So we have the welcome. We'll do the introductions. I just need the welcome statement and the mission statement. So, like I said, I don't have any paper with me. Normally I do, I'm sorry.
Do you want me to read it, Roseanne?
Yeah, if you can, we'll officially start the meeting. So we start with introductions. So are there any new members on this evening? No, not right now. Okay. All right. So, so the welcome statement, and the sunshine law we need to read. So I have it here. Welcome to the HIV Health Services Planning Council meeting of the Middlesex-Somerset-Hunterdon Transitional Grant Area. We usually meet at 6 p.m. on the first Tuesday of each month. The meeting is open to all who wish to attend. We request that everyone adhere to the ground rules on the back of the agenda. The sunshine law. The notice of this meeting pursuant to the Open Public Meetings Act of New Jersey, SA 10-4-10, Bill A 3850 has been complied with and shall be entered into the minutes of the meeting. Okay, and everybody knows the teleconferencing etiquette. If on the phone, press *6 to mute, unmute, *9 to raise your hand. So, okay, so we will do introductions now. I don't know, I don't think we really established an icebreaker, but when people you know, people would just like to you know, introduce themselves and maybe something they want to plan for the new year, I guess.
I'll start just to get the ball rolling. Hi everyone, it's me, Terry, and I have the huge task of decluttering that I am really looking forward to. I just ordered the pod today, so it's going to be some hardcore decluttering. And I'm going to go to my left, Kathleen.
Hi, this year I'm just winging it because it's like I don't know, a year where I'm gonna be getting severance pay for part of it and then unemployment for another part of it before next December when I apply for my Social Security, where I'll get full benefits if I wait till then. So I'm just leery about financial, how it's gonna go. So I'm not planning anything. I'm just seeing how it's gonna go this year. And that's about it.
Right, yes, Kathleen just retired last the 29th, so.
Yeah.
Congratulations.
All right, John, we'll go to John next.
Okay, I'm John Marcinkiewicz. I am the vice chair of the membership and outreach, mentorship and outreach committee, and a consumer. And I was gonna say I want to take a vacation, but Terry, with the not cluttering thing, you inspired me because I really need to do the same thing myself. So I really have to do that myself. So you inspired me. So that's my goal, is sooner than later.
All right,
And that's
thank
about
you,
it.
John. Steve, you're next.
Hi, my name is Steve Pitts. I'm a medical case manager with a VNA, and Kathleen, that's congratulations on your retirement. Talk to your medical case manager, get set up right with your Medicare and Social Security so you don't pay any penalties or don't lose out on the benefits you should get, you know. So anyway, and Terry and John, maybe we could chip in on maybe a backhoe for this decluttering or something. You know, I'm just trying to figure out how I could get it in the door here. You know, I moved 2 years ago from a spacious house where I had several floors, and 2 years later, I still have 12 boxes in the corner of my living room because I moved into a much smaller place, and I
I'm
have
a
a daily
107.
reminder.
All right, we'll come up, we'll try to solve that problem in our meeting.
Yeah.
Okay, Lucy?
Hello, Happy New Year. Lucy Counts, Middlesex County Office of Human Services. Well, this year we have a couple vacations to look forward to. But like everybody else, we're not newly decluttering, we're continuing to declutter so we can, you know, do fun stuff like paint and buy carpet.
Nice.
Dennis, you're next.
Hi, I'm Dennis, program coordinator with the VNA for Ryan White, person living with HIV, and I don't set myself up for like New Year's resolutions to fail. So just trying to be healthy, but now I kind of want to declutter. So maybe I will kind of get that started because I do need to do that.
Sounds like
And
we have a
congratulations.
budget line item here, Lucy.
Yes, congratulations on your retirement, Kathleen.
All right, Jose?
Happy New Year, everyone. I'm Jose Roman. I'm an attorney with Central Jersey Legal Services. My dog just came in. We provide services in Mercer, Union, and Middlesex County. And this year, I'm gonna tackle a backyard project, renovate the backyard, do something. I don't know what. Make it look nice.
Excellent, all right, make it look nice.
Make it look
Kareem?
nice.
Hi, everyone. Happy New Year. Kareem Darwish, medical case manager for the VNA. I will say I also want to declutter, but to pick something new, I just want to just be healthier this year. And I also want to read more.
Very good. Lara?
Hi, everybody. Lara Dykstra, New Jersey Department of Health, DHSTS, Division of HIV, STD, and TB Services. We actually started our declutter, I think New Year's Eve. I did make the promise, the holiday vortex, to organize my mess of shelves in the basement. So my husband held me to it, and then I actually dragged him down there, and he got excited. So we did the first stages of decluttering, and then I promised to do continued decluttering. So that seems to be the theme, I guess. And then to piggyback on Kareem, I did say I'm going to try not to buy any books so I can read the books of my own personal library that I already have. So I'm just, you guys are all right there with me. So yeah, the continued decluttering / sell my stuff and read my library.
All right, excellent. Siobhan?
Hello, Happy New Year, everyone. I'm Siobhan Cato, the program director at Zuffa Health Center. And I feel pressured, but I don't want to declutter. But for this year, no resolutions, but always trying to be healthier and that type of thing. So I'll say that.
Thank you. Tanya?
Hi, Tanya Williams, co-chair of co-chair of Mentorship Outreach. And Happy New Year's, everyone. And I, like Siobhan, feel pressure, but I'm not going to declutter. Okay, I'm not doing it. My thing this year, I'm only gonna do what pleases me and not everybody else. That's my New Year's resolution. Do what pleases me and not what everybody else. Don't care what everybody else thinks. Care to not care what everybody else thinks. Just do what I want to do. That's going to make me happy. So that's my New Year's resolution.
Thank you, Tanya. Okay, Kelly?
Hello, everyone. I'm Kelly Fowler, Hyacinth, Regional Service Manager. I don't do New Year's resolutions, but what I am going to try to do is employ some better time management skills so I can find some time for myself. I'm always so busy, and even when I go home, I'm working or I'm doing something. So I need to pretty much try to figure out how to organize all of that and find a minute just for myself, just to be able to decompress.
Very good. Very good. Okay, Jay?
Congratulations, Kathleen. I'm gonna say I don't make resolutions either, but what I'm committed is to myself. And some people have been referring it to being selfish, because I agree with Tanya and I agree with Kelly. My no is a complete sentence, just like my yes is. And I really feel, and I'm feeling this way because you all know I've had some problems, illness, so life is very precious to me. So what people think about me, I'm a good person, so I don't care. And whether they think I'm a good person or a bad person is none of my business. So that is what I'm going to carry. And I carry that, as you know, anyway. So I guess I'm going to just carry that same old self into the new year. But I
Right,
will
so-
make more practices around being conscious of the self-care. So like going to the spa or taking a walk or doing things that I'm conscious. I take the time out for that.
All right, thank you, Jay. Manu?
Hi, everybody. Minu Christian, Eric B. Chandler Health Center. I am really, really tired. It's one of those days. My January resolution is to get some rest. And I'm sorry if I'm a little off camera today. It's just one of those days, but I hope to get more rest this year. Thank you.
Very good. Okay, Vanessa?
Hi guys, how are you? Vanessa, medical case manager for VNA, and I think this year my hopes are to continue growing as an individual and owning up to my wrongdoings. So that's it.
All right, and then Lori?
Hello, it's Lori Dillon with, I work with Lucy at the Middlesex County Office of Human Services. These are so good. They're so inspiring. I'm terrible at resolutions, but I hope to become a better person this year in 2024. Thank you.
Right, and then we have Giovanni?
Hi, how are you? Sorry, I don't know how to turn on the camera and I'm still at work. If you hear the music, it's because I'm still at work. I think the only person that I know here is Mimo. She was the one who told me about this. So my new year resolution, I think, is I just find out that I'm HIV positive. So, my new resolutions is just to be happy, be healthy, and, don't care about what people say about me.
All right, thank you for sharing that, Giovanni.
No problem.
There's a couple of themes I think we have. So and we could all support each other, and we'll check in next month. So we could go ahead with the agenda, and we did that. So now the mission statement. The mission of the Planning Council is to establish and implement a comprehensive plan for the organization and delivery of HIV-related services as described in the Ryan White HIV/AIDS Treatment Extension Act of 2009. Thank you. Okay, now we need a roll call vote, a roll call of voting members. Sorry, not a vote. Roll call of members.
Roseanne Marone,
Present.
Manu Christian,
Here.
John Marcinkevich,
Here.
Jay Gavin,
Present.
Lara Dykstra,
Here.
Pete Franklin, Nope. Carlton Bruce, Kathleen Donahue,
Here.
Jose Roman,
Spacebar never works when I try to use it here.
Cheryl Bruce, Siobhan Cato,
Here.
Kelly Fowler,
Also present.
Kareem Darwish,
Here.
Tanya Williams. I know you're here. Where did she go? There she is. She's waving. And Vanessa Herrera.
Here.
And we have quorum.
All right, excellent. Thank you very much. Okay, so now, next on our agenda is the approval of today's agenda. So that is in front of us. So if people want to take a moment, to review, we, have Terry scrolling it about.
Yeah, okay.
Roseanne, I offer a motion that we accept the agenda as is.
Okay, thank you, Jay. Anybody like to second the motion?
I'll second.
Okay, Jay and John, thank you. All in favor, we can raise our hands for this type of vote. So if people wanna, raise their hand or use the little icon if they can, that's fine. So I think, let's see. We don't have John's hand.
Where am I?
Okay.
Can you see me? Oh, crap.
Okay.
I didn't realize my camera went off for some reason. My hand is
Okay.
up.
All right. Okay, very good. Okay. Thank you for approving the agenda. Okay, so moving along, our next item, number 8, is our administrative agent report.
Oh, you didn't have minutes to review?
What's that?
I said you didn't have minutes to review from your last meeting? Okay.
Oh, we didn't. Oh, it's not on there. We did that already. We voted on the minutes.
We reviewed the agenda.
Oh, we vote. So where's the minutes? It's not listed. I'm going purely by the list. Okay. Here are the meeting minutes from November. Feels like a long time ago because December we had the World AIDS Day event. So here are the minutes from November last year. Anybody want to make a motion to accept the minutes, please?
I make a motion to accept the minutes.
Okay, thank you, Thank you, Tanya. Anybody want to second it?
I'll second it.
Okay, thank you, Kareem. All right. Minutes from last meeting are accepted.
All right. Have to do
I can go now.
all in favor?
Oh.
Yeah.
Yes, all in favor.
Any nays or abstentions?
Do I have to abstain because I wasn't there?
Yes.
Okay, then I abstain.
Thank you, Lara.
I abstain as well.
Okay.
Okay. We're good?
All right, I can go now. Hi again, everyone. Few things that I have to report on. The first thing is we are in the process of getting award letters out for 2024. They will be partial awards. And Joe, for my office, my fiscal person, with his math, I think we're looking at about maybe 2 or 3 months of funding. So March, at least March and April, and possibly May. We wanted to send them out last month. We were kind of holding off to see if we would have our full award letter, or at least more information about how much funding we can expect, even if it's another partial award. But that has not happened. So I don't want to hold on to them any longer. I want to get them out so that people can start doing whatever it is they have to do as far as developing budgets on their end and, you know, continuing with the programs. This will be the last year of 3-year contracts. So we're just doing extensions into 2024 to start on March 1st. And then whatever services the agencies are providing, you all will move forward with doing whatever you can. And as soon as we know, whenever we get more money or how much we're getting, then we'll, you know, proceed accordingly, as we have in the past. We are doing a little, not reorganizing, regrouping ourselves in the office, myself and Joe. The site visits have been interesting, and taking us a lot longer than we had anticipated. For those of you who I think everybody knows, don't know, my Ryan White staff is myself and Joe, trying to navigate, you know, a handful of programs, amongst some other duties that are required by Ryan White. So we're going to finish out what we did this year, well, or for 23, and work with our project officer to move some into 24 and continue in that way. So whoever has not gotten a site visit will hear from me about what that's going to look like, you know, moving forward. Whoever already had a site visit, we have reports we need to get out, but nothing that is glaring and needs to be addressed immediately. So we're not like concerned about something that needs to be addressed like yesterday, So we're fairly okay with the ones that we have done. And if there was anything that needed to be addressed, we've addressed that with the agencies individually and are working with them to, you know, address the things that we did find. We are working, so there was 2 directives that Planning Council had. One was for mental health, Hispanic or Spanish speaking clients, and the other was for housing, emergency, short-term housing. We're working on that. Myself and my office director, Melissa, have had a conversation. I've also had a conversation with a number of programs that do something similar to what Planning Council wants. And I'll just be honest, it looks like it's going to be a very difficult task to undertake. And the reason I say that is in order to do that, any agency that does that would have to contract with hotels. And what we're finding now is that hotels are no longer wanting to take contracts for people to stay, because what is happening is they're not getting paid. People are being told, clients are, and this is not specific to Ryan White, this is just an overall thing. So this is like Board of Social Services clients, anybody who gets referred in statewide. So this is not like a local program, but like statewide, anybody who gets referred through 211 through to some housing agency, entity, let's just say. And so what is happening is if they're supposed to pay short term, you pay for 5 days, somebody still has to go somewhere in day 6. And agencies are not picking up day 6 through whatever, or if it's 10 days or whatever the case may be. But what clients are being told by people they work with is that even if no one pays, they don't have to leave the hotel. The hotel has to legally evict them. So now what is happening is hotels aren't wanting to take those contracts because people are not leaving, they're not getting paid. So we're coming up against, and like I said, it's not unique. It's not anything that's specific. And this is not a Ryan White issue. This is a universal thing that's happening. So, you know, there may be some, you know, like I said, myself and Melissa have talked about what the challenges will be. So I think I had said it even at priority setting that I didn't think it was something that could be accomplished by March 1st. So I don't want people to start expecting us to be able to place clients on March 1st because it's not going to happen. Yeah. But we're working on it. We're going to try to see what we can do to figure it out, however we need to do it. But there just has to be a lot more work done with that. And then the last thing I had on my list is I sent an email before I left on vacation for the holidays that we are no longer contracting with Elijah's Promise to provide food services to us as of the end of this program year, so end of February. And it's not an issue with the services that we get are good. The issue is that they're doing renovations to one of their sites, or will be doing long-term renovations to one of their sites. And so they don't have the ability to house fresh food packages. So meats, vegetables, if it's frozen goods and things like that, they just won't have the capacity to do that anymore. When I spoke to the director, they actually have been able to work with us a lot longer than they anticipated. So I'm grateful for that. But we are in the process of trying to find an alternate plan to get people food. What I can tell you is that there's not an agency that has the capacity Elijah's Promise has. So it will look very different if we have to provide consumers with gift cards to get to the store. That we'll have to do whatever we have to do, but there's not an agency that can replicate that program. It was, a very unique program in our area. And it's not an easy task to undertake to hold, food packages for 50 people over a long weekend or whatever the case may be. So again, my director and I have had a conversation. So we're trying to see the best way to facilitate that so that people can still get something, even if it doesn't look like what we were able to previously provide. We don't want to eliminate the service category completely because the provider can no longer provide the service to us. We still want people to be able to get something, but it will definitely not look like what Elijah's has been able to provide for us for, how many years that was. So by the end of this month, we should have, before March 1st, we should have a resolution to that will allow us to inform the case managers, since you all, case managers are the ones who refer the clients for said service. And I think, that's all that I have on my list right now.
Thank you, Lucy. Anybody have any questions for Lucy? Thank you for all your hard work. I know negotiating that, the temporary housing is pretty bleak. Same with, Elijah's Promise, but maybe the gift certificate option, maybe considered at least temporarily until, things may change.
Yes.
Okay, thank you.
And
So
I have a question. So since you touched on the food part, thank you, Lucy. Do we know, I know we're going to receive a partial award. Do we know what it covers, as in the time period? Or we don't know that, we're just going to get the partial award and then.
No, I said, I think what Joe calculated is 2 months, but we're going to try to see how we can stretch our pennies at least for 3. So we're going to try to at least do March, April, and May. So hopefully 3 months.
Okay, thank you.
yeah, tough all around, as we know, the federal government, I guess they passed some other kind of continuing resolution. There's really been no, I guess, official budget of some type. So, it's the ping pong and Congress that's going on. So folks understand it's bigger, way bigger than us. Let's hope there could be resolutions. Okay. So, excuse me, we have new business next. And that's something that we do every year this time of year. And those are nominations for the chair and vice chair of the Planning Council. So the executive committee, again, we've had some discussions. So Terry prepared a document. Now, individuals are eligible, based on their Planning Council, I'll say attendance. And we have this list, and if people are interested, they can let us know now, or they could let us know, you know, in the next couple of days. So can everybody see the, so Manu and I, are both, well, I'm terming from the planning council, meaning I have to, leave for a year or 2 years and then come back again. So, so here is the list of eligible candidates. Can everybody see that?
Yes.
Okay.
Yep.
Okay, so we have Manu, Jay, John, and Tanya for chair. And for vice chair, we have Cheryl, Carlton, Cheryl, Siobhan, Manu, Kathleen, B, Jay, John, Jose, and Tanya Williams.
Are we supposed to be like interacting now with this form?
If people would like to, yes, if people want to let us know, that's fine. This is open to discussion at this time.
So can I make a suggestion? Since we can't really interact, can you just do like the roll call of each position? And if the person is here, can accept or not at this time?
Okay, sure. Okay, so for chair, Manu, are you interested in being the chair?
Sorry. Yes, I'll be interested.
Thank you. Jay, are you interested in being the chair?
No, thank you.
Okay. John, are you interested in being the chair?
Not this time.
Thank you. Tanya, are you interested in being the chair?
Yes.
Yes, okay, thank you. Okay, so we have two candidates for chair.
Roseanne, can I just clarify? So if they accept are we assuming automatic nomination?
I think if they accept it, then yes, I think accepted and being nominated. You know, for the sake of understanding and time, that if that's okay with everybody, we can use those two terms as one. They accept in other words, they're accepting the nomination. That's how I put it.
Yeah, that's what I was gonna say. And I
Right.
agree.
They have accepted the nomination. So that's a yes for Manu and a yes for Tanya. Okay. Everybody good with that?
Yes.
Okay.
Yep.
So for vice chair, Siobhan, are you interested in being nominated for the position?
Not at this time.
Thank you. Manu, are you interested in being nominated for the position at this time?
Sure.
Thank you. Kathleen, are you interested in being nominated for the position at this time?
No.
No, okay, thank you. Jay, Mr. Gavin, are you interested in being nominated for the position at this time?
I will at this time decline, Roseanne. Thank you very much.
Thank you, Mr. Gavin. Okay. Mr. Markinkevich, are you interested in accepting the vice chair nomination at this time?
I'll also sit out this time. So
Thank
no.
you, Mr. Markinkevich. Mr. Roman, are you interested in the nomination for vice chair?
I respectfully decline.
Thank you, Mr. Roman. Miss Williams, are you interested in being nominated for vice chair position at this time?
Yes.
Okay, thank you, Miss Williams, and thank you, Miss Christian. So, we have our eligible nominations for chair and vice chair. So then we will, proceed on voting. The new term would start March 1st. So typically, I believe we do vote at the February meeting, if my memory serves me correct. So we will be voting in person at our next meeting on February 15th.
And just for your paperwork's sake, just Terry, to make sure you reach out to Carlton, Cheryl, and who was
Oh,
the
yes,
person
thank
on
you,
there?
yes.
Somebody, B, just
And
for,
B,
you know.
yes, the three that were absent today. Thank you, Lucy. Thank you. All right. Very good. All right, so that's our new business. And now for old business, we are having a presentation. Terry's very happy to present to us a review of the website.
Really quick, I would like to make an introduction. Jose, if you would unmute. That would be nice. That's even better. I don't want to make
Hi,
any.
friends. How everyone?
Jose
Nice
is
to meet you.
our web designer and has been working with me for 2 years on this website. And we have the honor of having a website with the most pages he's ever worked on. So,
It was small but mighty.
yeah. So anyway, for anyone who's new or for anyone who has heard about the website but doesn't understand what we're talking about, we started the website a few years ago with the intention of creating a website that could talk about our programs, but would also be consumer facing so that anybody who was looking for services would find it and they would be able to navigate the website and kind of figure out what they wanted or needed themselves. And the website was live for a little period of time. I actually don't know how long, I don't remember how long. But we still felt like it needed some more refinement, and we kind of feel like that's where we are now. And so this is our homepage that you're seeing right now. It talks about our TGA, comprehensive care. There's active links all over. Tonight at 8 p.m. it's going to go live. So I encourage all of you to copy the link. I'm going to put it in the chat a little bit and play with it at 8 p.m. and after. It'll be live tomorrow too, so you could just save it, save the link. I'll put it in the email as well, so you can fool around with it. And then we have our planning. There's a planning council page on here, which talks about what our planning council is and what we do. Just a little description. And obviously, one of the things that was really important to us when we were developing this website is that people who wanted to call or needed services would have a name and a number, and they wouldn't feel like they were calling an organization and having to talk to somebody who may or may not know what we're doing. And we all know that happens within our organizations. There's a link to the membership application. This is the only place in the website where we collect information. So you guys, when you are thinking about having somebody join us, you can always send them this link. Now this is the part I'm really excited about. And Jose, if I miss anything or if there's any features you want to talk about, feel free to stop me.
If you can click the About Us page directly. So the buttons themselves and then the sub buttons also have information. This right here is the context of everything, including the story as well.
Yeah.
So that everyone can.
Thank you. There's a lot to read. We have the program description. A few months ago, we asked, first thing I want to say is that when we initially developed this website, it started in the consumer quality work group. They actually even picked the URL that we're using and talked through some of the concepts. And then more recently, we added some consumer stories, which is, you can see here, our commitment to services, joining hands in the community. And this part is the really most important part to me, that people see they're not alone and that they can find us and hopefully come hang out and find the services that they need. So we have this services page, which lists all our services. It includes some prevention services. I want to say one thing, not all the services that are listed aren't necessarily Ryan White funded. We started with Ryan White funded, but anybody can find services for anything that they want. So we have this services page. All of these are links. You can, they're active links. I'll just kind of show you. This one link is a little different from the other ones, but you know, we have a link to the support group information for Hyacinth so that people can hop into a support group if that's where they're at and they're ready to do that. But let's say somebody wants, I don't know, name a service. Let's make this interactive.
Let's just say food services. Yes, food service.
Okay. So right now, we have the food services page, and it gives you the link to Elijah's Promise. I mentioned to Lucy that I would like to update this, but I don't know what the plan B is right now. So it's going to stay Elijah's Promise until we can figure that out, and maybe we'll figure out. Well, we'll rework some verbiage. Then you can see I just clicked on here. Oh, and
and it should work right now. There's something wrong. The theme owner of this is working on updates. It seems like there's some bubbling issues, but
okay.
yes, it's not a us thing. It's a developer thing. I have it happening in another website as well, just so you guys know. So if there's any like inconsistencies, it should fix by 24 hours in the next 24 hours.
Cool. So
Perfect.
here
Thank
we
you.
have the medical services page. And I actually need to add Chandler to this. I meant to do that yesterday and I forgot. So before we go live, Chandler will be on here. And then if I click on Raritan Bay, I get to their page and it gives me all the information. One of the things that I'm going to ask for your help with, and probably the case managers as well, is that we're trying to develop a standardized list here of the provider profile so that people know when they click on the link, if they accept uninsured consumers, if they accept people, whatever the age groups are, whatever restrictions there are, and if they have bilingual staff. That's just where we started, but we have a lot of other things to add. So we basically have a template for that. And
Terry, I have a question. I see you have Robert Wood Johnson. Is Chandler listed under there as well?
I just said they had to be added. I just said
Oh, okay. I'm sorry. I missed that. I was reading the copy.
Yeah.
I apologize.
It's okay. Yeah. So yeah, and that's where that's where sometimes the pages get tricky because you know, when we started building the website, we started with part A, services, and then but we wanted to branch out because so many of you have different consumers and different consumer profiles. So there's the care and treatment page, which, you know, you guys will understand sort of how we have this. No, that's not the care and treatment page. You guys will understand sort of why it's organized this way. So you can see care and treatment, that's code. That's planning council code for basically medical services. And then we have these interactive links for medical care, community-based case management, clinic-based case management, dental services, mental health, substance use treatment. And then if I were to go to support services, you'll see the same setup: emergency financial assistance, food services, legal services, support groups, and that takes you back to that support page, details about support groups right there. I will say this, I know I emailed everyone last week about support groups, and what has support groups available. The only thing I'm concerned about is that I don't want to post support groups for clients that have to enroll in a full suite of medical and case management services. It's one thing to have to enroll in the agency for the support group, but if there are other service required, I don't want to put that in the website because I don't want to set people up to be frustrated. And that's happened a few times this year because some people think they can just go to any agency that's offering support groups, and the agencies can only take their own clients because they only have that capacity. We included counseling and testing on here. I think we need to add a few more things to counseling and testing. I know Chandler and Robert Wood for one. There's prep and prevention. And next steps. This is my favorite link because I've looked through all this website. I want to talk to somebody. What do? You can click on this link and you can call somebody now, and you're going to get Lucy, and Lucy's going to guide you towards a service. This one is for support groups. And then this last one is for people who want to come to a planning council meeting. And another cool event. Oh, look at that. Here's your meetings. And guess what? The meeting links are there too. So you can add it to the calendar. And I thought we put the actual Zoom links in here somewhere. Yeah. And then when you click on that, you'll find the Zoom link. So all of you, next time I have to cover for Jen and I forget to send everything out as a reminder, you'll just be able to hop on over here. And oh, our bylaws are here. Look at that. And our service standards. And then we also, if you click on the resources page, we have links to other websites. I'm gonna, Jose, am I missing anything? Any features?
No. So, and then there's to get started, of course, because some people just they kind of get lost right off the rip and they want to just get started and figure out where they want to go. So there are some questions Terry provided me initially of, how can I select a treatment provider? If you click on the pluses on the left-hand side, they will show verbiage and a text that kind of matches who they are, or the place that's surviving. There you go.
Yeah, and so there's some redundancy, but that's
intentional because people want to travel the way they travel. That the whole purpose is really kind of a user journey. We went from text, from an Excel sheet and the locations that you guys provided to more of a visual format so that people can get to and understand. Now to keep in mind, this is version 1. This is the first of its kind. So there are going to be some inconsistencies. Once we do turn this on, I really, and any feedback that you guys may see that doesn't look right or needs to be updated, please let us know so that we can go do a much bigger launch, because that's kind of the touch-off point, if that makes sense. Making sure everything's matching, the buttons are being called in the right places, the services are being served in the right places. And, we've done countless checks over the last, 2 years of making sure it's right. But again, we're still not perfect. So it would be this is kind of like that post-production fixes or post-production updates, if I like to call it. But for the most part, this was a really, really fun project. Having to try to understand, and I have a much better grasp of what everyone provides, which is beautiful. So I want to be able to capture that and allow people to also see that as well. So, be a part of that as well and use the services, get to the right places. Aside from that,
really
again, I should have it on in the next hour or so. There are some again pieces that we're still working through, I believe, just because we're maybe like 70 pages on this website, which is it's a really big website, which is great. Just want to be able to get a user who has HIV for the first time or at all and wants to be able to go there and get to the location with the least amount of clicks. So where I think we were able to really accomplish that in our yeah, of course. Well, yeah,
that one.
So
that's my bad.
But again, this has been hours. We're talking hours and days of having to go back and making sure that we're mapping the right places. So any future locations or anything that does get updated is going to be much easier to do long term.
I will say you
Congratulations.
did an excellent job. It looks
Yeah.
good.
Looks
It's
great.
clean.
Looks great, Terry.
Looks
Looks
clean,
great.
user friendly, very clean. I like it.
Yeah, looks great.
I'm
I would
really
just make-
excited.
Can I just make a comment? This
Please.
font here, like right on this page, is there any way to make that a little bit bigger?
Absolutely.
Is that like
Absolutely.
not even a 12 font?
No. That they're often standard. So we do have standard text, which is often a 14 or 16 font. Most sites are moving to like 20 pixels. So I can globally change it so that it goes up bigger. Absolutely. That's
I don't
not
know.
an
Do people agree? Because it's kind of like it's a little
You're
bit.
you're looking at a smaller version of a laptop on that, right? Because it's just like if it was the whole screen, I think it would be readable.
Correct. Right now, we're just looking at a version of a version. Once you go in, you should be able to get a much. If anything, I would love to hear your guys' user feedback at some point from your screen, because like my MacBook, it doesn't work the same way as your Windows or MacBook or however it is.
Does it? Can I ask a quick question?
Absolutely.
Does it and then forgive my lack of techie terminology. Does it is it smartphone friendly? Like, does it automatically? Okay, cool.
Yes, that was intentional in many ways, having to make sure we can scroll through. If you can, I think I have a copy of it, but
I have a quick question too. Is there a way for us to give feedback directly onto the site right now, or should we email Terry or
Yeah, you have to
Jen?
I think we're
All
still going through Terry for just consolidation, just from all areas, and then she'll come to me. Then I think our next meeting is later on this week, just to come finish up post production, of course. And so
I
it's like
have a question.
Friday-ish. Please.
I agree with Roseanne for the simple reason that many of us are using our smartphones.
Yes.
So that 20 font, I think, would really, because I can go in my phone and make it bigger, but then I lose the page.
Yeah. From there, we've been really conscious in keeping in mind what it's going to look like on a desktop versus a mobile, and they are two separate codes. Just so that you guys know, from a coding perspective, I intentionally have to code in for mobile. It has to be this size, and so we want to be conscious of that, especially as people scroll through. Not just you, but just general audience, of course. And a lot of the phones sometimes tend to be like Galaxy phones or so I need to be able to make sure that it's available for both an iPhone and an Android phone. So that type of testing can be extensive, of course. And I mean, we do as much of the testing as we can before we show it. And so this is called post-production testing. Please take a look at the website on your phones and on your desktops. See that your locations are working. If they are working, if they look right, if everything's matching, great. If they're not, please send any concerns or updates to Terry. Terry and I will make sure we can tackle it and then give you guys it'll be updated in real time, so you'll be able to see the changes as early as next week.
Great. And Terry, you're going to share this with the case managers tomorrow too?
Yes.
At the monthly meeting?
Yeah, absolutely. I really want, after this meeting, when we go live, I really want everyone to look at it and start using it and emailing us about any inconsistencies, because we built this website 2 years ago. We started 2 years ago, and we had a version of it that we went live with. And then I hired Jen, and she was like, I think that it needs to be more dynamic, and we agreed. So we kind of redid how it was organized. It's organized completely differently than it was in the beginning. And I think it's much better now, even though we've shown it to some people. They like the older version, it was fine, but this is definitely a little more safety net oriented, I feel like, and it will definitely bring people back to where we want them. And then the other thing is that if if somebody clicks in your provider agency, we have pop-ups. So they ask, you guys might remember, I asked you a million times, who can they talk to or whatever. At Zufall, they're going to get Elias's or Erica's extension. At VNA, they're going to contact Dennis directly. So I really wanted people to have a name and somebody they could ask for. It's going to be a little maintenance on my end, and something we'll have to like remember to keep up with. But I don't see why we won't be able to do that. And then the other thing is that we're hoping that mentorship and outreach committee will be interested in doing more a little bit with social media. And then we can make that loop between mentorship, social media, and the website so that people know it's out there, even if we're only doing 2 posts a month on a Facebook/Instagram, those kind of things. So that's what the plan is for use on our end. And the other plan is we're hoping that people find it and find us.
Looks great.
Just to reiterate, so we were having updates. As you can see, it's updated now. Whoever the developer is working on there to fix, but Elijah promises fixed. And this is how it should look. If you can see, the buttons are working the way they need to. And I mean, services offered, you got a little mission, and then your service providers, location, button to click. The best part about it, of course, is it should translate both to text and mobile. So buttons right off the top so that you can call someone, check the services, request support, see where the location is.
And it also sorry, I just wanted to say, it also links to some of the link to your, like if you click on some of the buttons, it'll link to your website. So for those of you who have websites, it'll link to whatever that Brian White page is or looks like. But we really felt like this website was necessary because in a lot of cases, your agencies maybe have a paragraph or something, and it's more speaking agency to agency than it would be speaking to a consumer in terms of how to get help.
Oh, that's excellent. Yeah, they're supposed to be redoing our website too, so I don't even know the status of it. But that's great. I think this, I think it looks, user-friendly, as they say.
Yeah. Thank you guys so much. I think this was
Thank you, Jose.
really...
Very nice to meet you.
Thank you, Jose.
Nice to meet
Did
you,
a great
everyone.
job. Thank you.
Thank you so much.
Absolutely.
Thank you, Jose.
Thank you so much. Now, again, next steps, please, in about an hour or so, I'll have it on and take a crack at it. Break it for me, please.
All right, that's the term. See, that's a techie term.
Exactly. And thank you, everyone.
All right.
Thank you, Jose.
Thank you.
Okay.
All right, so we have. Okay, next on the agenda is the committee reports. So executive committee meeting met a couple of weeks ago. We're responsible for overseeing the overall function of the planning council and committees. At our meeting, we discussed, of course, we went over which will be in the quiz report. We go over what the other committees do. So I will leave some of that to the quiz committee, as well as mentorship and outreach. But we did review the bylaws, so we are tweaking and making some changes to the bylaws, and we also discussed nominations as well. Okay. So now, so membership and bylaws is also under the executive committee umbrella. And we did spend some time at the last meeting reviewing the bylaws, making some edits, which are then forwarded to Lucy for review. And will then, of course, if there's with any bylaw changes, we will come back to the full planning council for a vote. Okay? Did I miss anything? It was like a long time ago. No, okay. All right, so Manu, would you like to give the QUISP Quality Improvement Strategic Planning Committee? I think I'm finally getting the name right.
Thank you. Yes, so we did have the presentation for the assessment of the administrative agent. That will be coming up for you guys next month. We had a couple of suggestions that came from it, or sorry, I should say there was one suggestion that would include two of the recommendations that the assessment, there were some comments that we noticed. So we will share that next month with you all. The other thing that we discussed was updates to the standards, that is the emergency financial assistance. We had a lot of discussion around that, really good discussion. We're not quite ready to present what that is all about until we do a little bit more research. So we will be, some of our members will be attending case management coordination meeting tomorrow to ask the case managers their thoughts on emergency financial assistance. And once we have something a little bit more concrete, we'll share it with the full council. And I think that's what we did in December. Thank you.
Okay, so the next meeting is Tuesday, January 16th, which is a week from today.
Yep, thank you.
And you meet in the daytime. So if anybody's
Yes.
interested, and I want to thank everybody on the committee for all their hard work. Okay,
Thank you.
Mentorship and Outreach Committee.
Okay, Mentorship and Outreach Committee, we met, we talked about, John explained what the live flyer was. There was a question that was asked what a live flyer was, and he explained what it was. We also talked about doing events at churches and support groups. Jay also talked about going to an event that he spoke at, and how he thought that it was very important that we go to other support groups and do other outreach at other places and have other people come in and speak to. And we also, Siobhan mentioned that Raritan Valley had a sexuality gender organization where we can also do a live flyer. She also mentioned reaching out to other schools, and Terry suggested that we do events at and which we would present. And John also suggested talking about the proper with the suggestion that Terry made. He also talked about the having somebody come in and speak to us about other things, about the proper cleaning of toys, and mention of putting up tables at events. He also we talked about the Terry stated that to learn who to reach out to, we can write we can also form like we all had to come up with a list about who we can reach out to and maybe bring that to the table as well. What else? We talked about having speaking to how we used to speak to pharmaceutical companies like the pharmacies a while ago, and having to speak to other people at other events. And John also mentioned about pharmaceutical company presentations as well. Terry suggested about a series of that case managers are doing, and having consumers approaching and talking to the case managers. And that's basically, Terry also talked about reaching out to do, having a transgender come in to do one of our meetings in March. And that's basically what mentorship and outreach talked about at our meeting. John, is there anything else that I'm missing?
We also went over like a debrief of World AIDS Day. And we just want to thank everyone again for the last time for helping and making it a great thing for the amount of time what we had to do it. And what we're going to try and do start earlier this year, and you know, so we can make it even better. Let's see what else. We talked about a lot of stuff. It was a
Yeah.
lot of a real lot of stuff. So that being said, I invite everybody to come to our next meeting. So you know, it's sometimes it's lost in translation with the notes of some of the stuff that we talked about, and it's all a work in progress. It's a new committee, and we're, you know, just taking off, you know, out of the gates. So and we got a lot of stuff on our plate. So we're trying to get everything evened out and everything. And we love to have other suggestions, or you know, suggestions of things that we could do, or ways to make things better, to, you know, get people in to join the planning council, get the word out for what we do and how important it is and stuff like that. Terry, do you think, did we miss anything, or you want to have anything else
We
that we
also
should say?
talked about having a subcommittee for the next World AIDS Day.
Oh yeah.
And also getting that committee up and running probably within the next couple of months. So we also talked about that too.
Yep.
Yeah, I just wanted to point out that Roseanne said bravo about World AIDS Day, and maybe give everyone an opportunity to provide feedback. I think most people here are at the event. Did anyone else want to say anything about World AIDS Day?
You know, great job by the committee and the host and the organization. I know people really, there was a lot of good feedback about the panel, the panelists, the questions for the panel. So, you know, those were some of the things that I know, and we were fortunate to have Reverend Ann Shammy again. So, you know, she brings
And
that.
Dr. Jacob and Vanessa's
Dr.
video
Jacob.
too. A lot of people like
Vanessa's
were
video.
raving about the
Yeah,
video.
there was so many different types of you know, venue, like you know, different venues. Everything was really you know, very special. Considering the you had a extremely short turnaround time and really limited resources. So without a doubt, it was we consider it one of our very best. So, and the entertainment. So you know, again, just to thank everybody formally from the executive committee. So keep up the good work.
I am trying to squeeze in.
Oh.
I'm sorry, when the window of opportunity had opened at first, I was not available to squeeze in, but I must say, bravo to everyone naturally that worked on it. But to John and Tanya, I want to just give a little extra special, and the reason why is because they had the enthusiasm. They didn't see the picture being too big. And no matter where they got doubt from, they pressed on. And it turned out to be great, very successful. And just also, even though he's not here, Anila the doll also, as we have for our entertainment. So, but yes, I think you guys did an excellent job.
You too. Thank you.
I just want to add, I agree totally with what Jay Gavin said, because I didn't really, you couldn't really tell that it was done very quickly. So if that's what you guys can turn around in a short period of time, I'm excited for this upcoming year. So bravo to both of you.
We're excited for next year too, right, John?
Yeah. Yep.
I'm excited because next year we'll have the website. We can announce the event on the website and the social media page. So we'll have those two tools that you didn't even have this year. I mean, we did do a social media page, but we basically, it was very makeshift.
Yeah. It'll be great. And yeah, and thanks for all the again, Roseanne and Manu and Dr. Jacob and everyone that came the last second and did their thing and had to stay late because it ran a little bit late, but it was awesome. And Jay, he knows his World AIDS Day, so it really worked out. A lot of work, but it worked out, and it got cleaned up real quick too. So that was awesome.
Thanks again, Jay, for emceeing.
Yeah, and for the performer.
Entertainment.
It's what I do.
Hey,
I love it.
Thank you, everybody. Okay. Any other questions? We
Thanks,
can.
Tanya.
Yep. Thank you. And Tanya's, I think the restructuring of the committees, definitely. And I want to give a shout out to Jen, who really, she's not
Oh yeah,
on leave right now, but I think her energy was a good shot in the arm, so to speak. So,
definitely.
Appreciate that as well. So thank you, everybody. Okay, so now it's
Can I
time.
say this, Roseanne? I'm sorry.
Yes.
Because when you mentioned Jen, you really never miss the water till the well runs dry. And it's kind of like a break-in for us because we got used to her and now she took a leave. So we're like waiting for her to come back. I think that's a great thing.
Yeah. No, sure. Again, I think the new people, the younger people, again, they instill new energy, bottom line. So it's all good. We all continue to work together and, Kathleen, again, people have been on that committee. There's a lot of steadfast dedication, is a word, we can, a word that I would use to say, definitely. So, thank you. All right, so next is public forum. So we have an opportunity now, if anybody'd like to bring up anything, at this time. Like we said, the world's a bit chaotic at this time. The New Jersey housing crisis remains significant. We see more, homeless patients. So that's a concern. We also, I don't know, we're starting to see again, with the buses coming from that state down south. I don't even like to say the name of the state without raising my blood pressure. Anyway, so individuals, being dropped off like that, like really, I just breaks my heart. So, if we may or may not see some influx, but, that those folks, they said some of them, had relatives to go to or whatever, but, that's to be seen. So, these are, challenging times. And, the needs of people. Excuse me, and especially the concern with Elijah's promise, but we're gonna remain hopeful. We're gonna think positive, and we know together we can get it done. So
I just wanted to mention that we're still working on a needs assessment, and I wanted to agree with you, Roseanne. I've been surprised at how many people who've responded to the survey who've said that they've been homeless in the last year, both for our status neutral and our Rhine white patients is really surprising to me, the number of people who have experienced homelessness in the last 12 months.
been the grimmest year regarding that, as you know, in my memory. So anyway, with that, okay, so Lara, do you have an update from Part B?
Hi, everybody. So it's, coming out of the holiday, slow news day, a bit. I don't know if I made the announcement back in November, because I feel like it had just happened, or I was away at the HRSA conference, something or other, but Greta is the acting deputy commissioner as well as the assistant commissioner. So that may be old news to most of you, but I just wanted to officially announce it here. I do believe, and Chelsea did say this during the HIV coordinators meeting, that they are actively seeking a permanent deputy commissioner. So that would be the one under Caitlin. But as of now, Greta is the acting deputy commissioner. Does that mean Greta will be? Who knows? Stay tuned. Does that mean that they will find somebody else and she says, no, thank you? Who knows? Stay tuned. I don't, we all know how these government appointed positions work. I don't even remember her name now, who was here for like a hot second and then she was gone. She showed up at HPG and I swear 2 weeks later, she was like, hey, I'm leaving.
She was gone.
She was gone. So yeah, so just another day on the merry-go-round of government employee-ness, if you will. Did you have a question, Terry?
No, I was waving by Manu. I'm sorry. I just realized how misleading that was.
Okay. Yeah.
Lara,
Steve?
I have a question. This is Steve.
Yeah, I know Steve.
Cheryl Mills was the on-floor manager for ADDP for about 20 years, and she just retired on December 31st. And she was like the hub of the wheel down there. Do you have any idea who would replace her as the person in charge? Because all of the case managers, we interact with them sometimes on a daily basis.
Who outside of Cheryl, who do you speak with?
Is
Pardon me?
Eileen Venozzi part of that?
Eileen is
there's a lot of new people. There's a lot of
in regard to dare I say, like veterans or old heads. Eileen is still there. And Nilda's still there. I know Nilda deals with ADD. It's so being on the PMO side and more the prevention side. It's a weird, unfortunate siloing, but I can find out for you, Steve.
Okay.
Yeah, because somebody just
him.
left our new case manager just left a message for Cheryl Mills. We didn't even know she retired.
Okay, while we're talking right now, let me just.
Yeah, and because we typically get real quick turnaround feedback, but
and then was there an away message put up saying please forward
No, there's just new people. There's a lot of new people, and Eileen takes care of HIPP.
Right.
Cheryl was the
Okay.
ADDP person that's gone, and it would be great if we can forge a relationship with who's ever in charge now. I don't know if it just seems like whoever picks up the phone.
Forgive me for turning my camera off, but it might be the storm, but my internet is terrible today. I just want to type up a quick little.
Amy's here.
Huh?
Amy Poehler's here.
Yeah, well now she's here, right? If only I had her money too.
Now I had a long talk with Cheryl, and she told me she was leaving because I had a couple of very strange situations with people because they've started recertification, and I guess with some of the personnel changes, and this is not blaming anybody, but a few people sort of slipped through the cracks. So we were addressing them, and Cheryl's been just incredible in her role for 20 years. And sometimes when push comes to shove and you need somebody to make a decision, you know,
Sure.
and
Steve, if I can interrupt you really quick, did she
I'm
spell
done.
it with an S or a C? And just so she's not popping up, just so I can get it correct.
Okay. But that's all I had to say. We're just
Oh,
curious.
no,
because
I
the
found
case
her. Were you
managers
guys
deal
able
with
to
it.
hear me or no?
Yes.
Can you hear me?
Yes.
Yes.
No, I just found her. I couldn't tell. Was it CHERLYL?
Yes.
Cheryl Mills.
Okay. All right.
Yeah. Thank you.
No problem. I'm just gonna put her in the CC, see if anything pops up, and then I will send this to Nahid and see if she knows anything.
Okay.
All right. All right, I will follow up with you all on that. And then the only other thing I have, this is kind of fresh off the press from yesterday. This goes, since, you know, harm reduction is a big, it is a very big deal. It's a very big deal to DHSTS. And I know Murphy signed legislation, a lot of it embodied a lot that had to do with decriminalizing a lot of paraphernalia that had to do in the cannabis spaces. But within that, we also had harm reduction harm reduction supplies are exempt from criminal penalty. I'm going to drop the press release in the chat. So things like testing strips for naloxone, xylazine, which is the newer one that just hit within like the last year or two.
Yeah, I just heard about that.
Yeah, if
Xylazine.
you're caught with that, you cannot be, you know, criminally charged for drug paraphernalia. So if you are
Wow.
given that now from a harm reduction space, or if you're given it in order to test your you know, your drugs to make sure that you're taking safe drugs, you know, it's just one step forward. So that was good news. So that's what I have. My computer is moving so terribly slow. I am so sorry, guys.
Yeah, I know it seems that it's raining harder outside here. I don't know if that's the same for everybody. So we're gonna wrap up in a minute or two. Okay, so we're on to announcements. Any program announcements? I mentioned we do have a new full-time family case manager who replaced Donna Fong. Her name is Tara Filez Ami, and she has extensive experience working with the special needs populations. She started right after Thanksgiving, and then we also finally hired a new program assistant to replace Chrissy. Her name is Erica Knack, and she worked up at the New Jersey Medical School dental program. So we're fortunate to have her finally onboarded, because again, these things at Rutgers are always interesting. And those are our two new staff. I know Tara came to the case managers meeting last month, so she got to meet everybody. And I know that hopefully tomorrow her and Catherine will be on the meeting. Okay. Thank you.
Is the Part D meeting tomorrow, Rosanna?
Yes, tomorrow is the Part D meeting, and I already forwarded you the link.
Thank you.
Yes, so the Part D meeting, that's the Ryan White HIV Family Centered Care Network. The 7 sites, we meet monthly on the second Wednesday of the month, unless the meeting is canceled. or unless we have a case study day, so. Thank you for that. And Kathleen and Tanya have been members. Kathleen, again, is our veteran member at this time, so she, you know, keeps things going. All right. Any other program announcements?
I've got a quick update. It's Lori Dillon. Middlesex County is launching a broad new behavioral health initiative. One of the elements is our behavioral health navigators, which is tier 2. We're launching the program this month. It's got universal eligibility for any Middlesex County resident. We're also doing this program called PYX, P-Y-X. That's for young people. I think it's 13 to 18. It's a kind of a technology app to address loneliness. And we're looking at something called Credible Minds, which is really for anyone. So I would love to have somebody from our administration come to one of the planning council meetings this spring, just to give you a real quick overview. So you know this is happening. And also, Lara, our office works very closely with the New Jersey Harm Reduction Coalition, and we're super excited. We had a meeting with them today. We are starting to do also this spring 2 24-hour, 7-day-a-week harm reduction kiosks. One in New Brunswick, and the other will be hopefully in Perth Amboy or else Woodbridge. And they will contain naloxone, Narcan, fentanyl testing strips, and xylazine test strips, as well as resource information and other things that people need.
That's awesome.
That's a miracle.
It
finally got funded, right? So the harm reduction got funded with the new RFP that went out.
Well, actually, we're doing those kiosks with opioid settlement money.
Ooh, okay then.
And we've actually been doing kind of a harm reduction light on wheels. That's a mobile outreach for recovery and education. We do that with some innovation money that we got right when the pandemic hit, but it's still rolling. And we didn't, this is how we roll. We didn't realize that fentanyl testing strips 3 years ago were considered paraphernalia. So we were blithely handing them out, presenting on that at a statewide meeting with all the other county counterparts, when we were informed that they were in fact not legal, but fortunately they were made legal shortly after that. But again, just like everybody else, we were appalled that didn't include the xylazine test strips. What's great about this latest legislation is it's super broad, and it will include any kind of ending this whole legacy of the war on drugs with regard to paraphernalia that people need to stay safe.
It's very broad. When I was reading it, it's not very like needle specific, this, not that. So yeah,
Yes.
anything to help test, prevent any type of preventative harm reduction. Yeah. So Murphy's doing a good job with this. So getting it in with as the clock is ticking. So I'm very happy.
Impressive. Thank you.
Yeah.
Thank you for that. It seems that there's like we said, there's always got to be a little glimmer of hope here. And
yeah, I just wanted to make a comment that our Asbury VNA office has a harm reduction center there that they actually been using the test for xylazine before it was legal. So now they're able to just come out with it and do it legally. So we're kind of happy about what Governor Murphy did there. It's important.
Yes, without a doubt. So anybody have any other announcements? If not, I'll accept a motion to adjourn.
This is Jay. I will offer a motion to adjourn tonight's meeting.
Tanya, a second motion.
All right, thank you, Tanya and Jay. Everyone stay well and dry. hopefully, there'll be no terrible flooding, but we do have the whole night ahead of us, so, batten down the hatches. And we'll see each other in person on February 15th.
Eat all the ice cream out of your freezer. It's part of your decluttering.
Oh, I just want to give a little tip about decluttering, if I may. So one of the things that's best to do is really not to get overwhelmed by the whole job. And it really helps to just say, I'm going to do the corner of a room, or I'm going to literally just do a drawer. And those little things, you build a momentum. And sometimes I know, like, I'll only set my timer when I'm doing some decluttering, you know, half hour, 1 hour. If you think you're going to tackle it all at once, it's not going to happen. Take it from experience.
And if I can piggyback on that, if there's something that has sentimental value, but it's kind of like, all right, it's not really anything and I'm attached to it because it's from this whatever thing, but it's some plastic thing that's literally just taking up space and I'm only looking at it because I'm decluttering and I forgot all about it. Take a picture of it. Take a picture of it, go get the Time Hop app. And when you get the Time Hop app, it'll come up every single year and you'll see it. And then you'll think of the memory of the thing. But now the thing is either donated somewhere or, you know, decomposing somewhere. Because
I like that. I like that.
yeah, that's when I had to consolidate 2 houses. I was like, all right, forget it. I can't. My mom just put too many sentimental impressions on things, and I'm like, I just can't. So, and then even when, you know, my husband was like, well, take a picture of it, take a picture of it. So, and then I can look at it and I'll go, oh yeah. And then it's the memory. It's not the thing. It's the memory. So
I have a pair of my daughter's shoes when they were baby, and they're like part of my decor. And my daughter was just saying, Dad, why do you still have these up? And I'm like, it's sentimental, but I never thought, take a picture of it, pack them away.
Jay, my mom gave me my baby shoes and I'm like,
Oh,
what the hell am I going to do with these?
The
And I
bronze
literally-
ones? You mean the little bronze ones?
Yeah.
The
Yes,
bronze
the
babies.
bronze ones that became a picture frame. And I go, what am I going to do with this? And I took a picture of it and bye-bye bronze shoes.
Did you melt the metal? Get some money?
I don't know.
I know, geez. Okay, no, we could go on and on. Those are some, definitely with the picture, but, it's
Those are
good
good
to,
ideas.
it's good
No,
to,
I got an idea. If you ain't wear it after a year, get rid of it. Okay, get rid of it. A year and
Sign
a
on
half,
for
get
that.
rid of it.
I agree with that.
yep, they say we only really
I do that
wear,
one every season. If I
Get
didn't wear it the
rid of
last
it.
season, this season, it's gone.
Get rid of it.
yep, okay, Kareem had to sign off, his internet's going a little wonky, so, all right, it's like the Italian goodbye. We started, we do about 5 different goodbyes. Like, goodbye, goodbye. Okay, I'm gonna leave now. Okay.
Like an
bye.
Allman Brothers song, it never
Yeah.
ends.
Never.
Hanging up now. I'm hanging up now.
Next meeting's in person.
Next meeting's in
Yes.
person, February 15th. Keep
night.
positive.
Cool.
Bye, everybody.
Okay,
Good night,
good
everybody.
night.
Have a good night.
Bye, everybody.
Good night.
Don't forget the website.
Right.